In this video, we demonstrate the surgical technique of the Samsung Medical Center knot and present a modification to facilitate education. The Samsung Medical Center knot, known as the SMC knot, was first described by Kim and Ha in Arthroscopy in July of 2000. Following this, in this landmark article by Lowe et al. In Arthroscopy, the authors assessed 6 sliding knots tied by hand, including the SMC knot. They concluded that any of the above sliding knots with 3 reversing half hitches on alternating posts provided sufficient knot security to clinically withstand physiologic in vivo forces. Since that time, numerous studies have found that the SMC knot has similar or better biomechanical properties when compared to other arthroscopic knots. Additionally, in a study evaluating knots tied by trainees, the SMC knot was found to have a higher ultimate load to failure compared to other arthroscopic knots, following a simple training session, leading the authors to advocate for the SMC knot to be a part of orthopedic residency training. We will now begin the knot demonstration. This is a sliding locking knot which is begun with a post and sliding limb. In our demonstration, the post is in the right hand in the figure. The post is held between the thumb and long finger while the sliding limb is passed over the post. The sliding limb is then passed behind both itself and the post. The index finger is now holding the base of the knot while the long finger is placed as a spacer. The sliding limb is again passed in front of both itself and the post. However, this time the sliding limb is only passed behind the post limb and crossed back in front of the post. The free end of the sliding limb is then passed up through the space preserved by the long finger. The free limb is grasped by the left hand while the index and long fingers are removed as spacers. The index finger is subsequently positioned in the most recently created loop. The knot is dressed by pulling on the loop with the index finger. The post is then pulled, sliding the knot down to the desired tissue, and the knot is situated to prepare for final tightening. Once the knot has been positioned with appropriate tension, the free sliding limb is pulled to lock the knot. In this video, the post limb is on the right. The sliding limb is then passed over the post limb and then passed over both itself and the post limb one time. Next, it is passed around only the post limb, and the free limb is then passed up through the loop preserved by the long finger. Next, the index finger is used to grab the most recently created loop to prevent premature locking of the knot. The post limb is then pulled to bring the knot to the tissue. The sliding limb is then pulled to lock the knot. The sliding limb is passed over the post limb and then around both itself and the post limb using the middle finger as a spacer. The sliding limb is then passed around the post limb only and then up through the space created by the long finger. Subsequently, the index finger is used to grasp the last created loop to both dress the knot and prevent premature locking of the knot. The post limb is then pulled to bring the knot to the tissue. The sliding limb is passed around itself, and then the post limb and itself in its entirety, followed by just the post limb. The free end of the suture is passed up through the space created by the middle finger, and the index finger is used to grasp the most recently created loop to prevent premature locking and dressing of the knot. The post limb is pulled to bring the knot to the soft tissue. This is seen intraoperatively using the arthroscopic cannula for visualization. A knot pusher is then placed on the post limb and slid down to the knot. Tension is placed on the knot, and the sliding limb is then pulled to lock the knot in place. Several half-hitching knots are then thrown.